Pharmacology 2, Unit 4, covering chapters 9, 17, and 18, continued. Urinary anesthetic. Phenazopyridine, also known as pyridine. The action, it acts locally on urinary tract mucous membranes to produce an analgesic or local anesthetic effect. It has no antimicrobial type of activity. Urinary anesthetic. This is a classification of a drug referred to as phenazopyridine, known as pyridine. It is an over-the-counter drug. It acts locally on the urinary tract mucus to produce an analgesic type of effect, and it has a local anesthetic result. It has no antimicrobial activity, which means it's not an antibiotic. It is the only drug in this classification. It can control symptoms of a urinary irritation, including burning, pain, urinary frequency, that often result from an acute urinary tract infection. Phenazopyridine is said to work like an aspirin for the bladder. The usual adult dosage is 200 milligrams orally, 3 times daily after meals for approximately 2 days. The medication does turn the urine orange-red in color. This can stain the toilet and the clothing. If you use vinegar in the toilet, it can dissipate that discolorization. The phenazopyridine does not treat the cause of the irritation to the bladder. It is not an antibiotic, and it cannot cure a urinary tract infection when it is used alone. Urinary tract infections can cause frequency, urgency, pain, and blood in the urine. They are usually treated with broad-spectrum antibiotics such as Bactrim, Augmentin, analgesics such as pyridine, and antispasmodics such as methenamine and or flavoxate are medications that are used in combination. Urinary antispasmodics. They inhibit the involuntary nerve, induce contractions of the detrusor muscle in the bladder, allowing the bladder to relax. Oxybutynin, also known as ditropan or Uritrol. Tolterodine, known as Detrol. Certain antispasmodics, such as these drugs, are used to help treat urinary incontinence by decreasing the contractions of the bladder, and this helps to eliminate the urgency symptoms that lead to wetting accidents. These medications are taken orally, and a few are additionally available as a transdermal patch. Those that are available and applied as a transdermal patch are applied on the upper torso, and the sites are rotated. They are applied and usually rotated on a day-to-day basis or every 7 days, depending on what medication is prescribed. Because these medications have an anticholinergic type of effect, it is important that the patients understand that they may have side effects that cause dry mouth or dry eyes. It is important for them to understand that they can contribute to heat stroke because of this, meaning that the patients may not have that ability to sweat, and they should be aware not to expose themselves to extreme heat temperatures, to stay in cooler places. Urinary retention can also be a side effect. Patients that have glaucoma may experience more blurred vision and may have increased ocular pressure. And of course, that anticholinergic type of side effect with the inability to sweat that we talked about increases the risk for heat stroke. Hyperthyroidism, also called an overactive thyroid or thyroid toxicosis, is a condition in which the thyroid gland secretes excessive amounts of thyroid hormones, known as T3 and T4. This hormone excess causes general body metabolism to be greatly increased. Although there are different causes of hyperthyroidism, the most common is Graves' disease. Its typical characteristic symptoms, as you can see here on the slide, is the bulging of the eyes, also known as the ophthalmos. The types of hyperthyroidism causes the patient to have a goiter, which is the swelling or the protruding appearance of the thyroid gland there located in the throat, which is the swelling in the neck caused by the enlarged thyroid gland. Continued excessive amounts of thyroid hormones can cause toxic side effects in some organs, especially the heart and the nervous system. When hyperthyroidism is caused by Graves' disease, the bulging and the protruding of the eyes, blurred vision can also occur. Severe hyperthyroidism that causes life-threatening hypertension, heart failure, and seizures can also called thyroid crisis, also known as a thyroid storm. Fever is often the first indication of a problem because the metabolism is revved up or speeded up. This condition is an emergency and can lead to death if the thyroid hormone levels are not decreased immediately. Antithyroid drugs. An example is propylthiouracil, also known as PTU, and methimazole, known as Northix or Tapazole, also known as iodine-131. The iodine-131 reduces thyroid hormone levels by entering the thyroid gland and combining with the enzyme responsible for connecting iodine with tyrosine. Patients that have hyperthyroidism have serious consequences. For some people, treatment consists of either surgical removal of all or part of the thyroid gland, radiation therapy with radioactive iodine can also reduce thyroid gland function and the production of thyroid hormones. The therapy with antithyroid drugs, such as iodine-131, can be used short-term before surgery or long-term to prevent thyroid hormone production and to control the disease of hyperthyroidism. Antithyroid drugs work directly in the thyroid gland to stop the production of new hormones and prevent the enzyme from connecting iodine with tyrosine to make active thyroid hormones. The drugs serve as a decoy for the enzyme so that it works on the drug instead of connecting these two substances together. As a result, the new hormones are not made, but the ones already made and stored within the thyroid gland are not affected by the drug. The drugs do not affect stored hormones, so it may take several weeks before the effects of all the stored thyroid hormones are gone. Your nursing implications for antithyroid drug is assessing the patient's vital signs, especially for the elevated temperature that may be associated with infection, checking the patient's blood counts for signs of bone marrow suppression, such as a low white blood cell count, anemia, or thrombocytopenia, which would mean a low platelet count, checking the patient's drug list for drugs that have an antiplatelet action, such as warfarin. Assess the patient's skin for signs of bruising or bleeding, such as ecchymosis or petechiae. Notify the healthcare provider if these appear. And before giving these drugs, check the patient's liver function test because before or both are toxic to the liver, also known as hepatotoxic. For example, patients who are already having liver problems, the effects of an antithyroid drug on the liver are more severe and can occur even when antithyroid drugs are given in low doses. The planning and implementation carefully check the dose of the specific drug name that is prescribed. The drugs are not interchangeable, and we're talking and referring to the methimazole. It is 10 times stronger than the propylthiouracil, also known as the PTU. Notify the healthcare provider if there are adverse effects. Now, the iodine-131 is not even compatible or comparable to either one of those two drugs. It's completely different. So make sure that you're looking at all of these labs before administering any of these medications to the patient. While taking PTU or iodine-131 or methimazole, it is contraindicated for a childbearing woman to be taking any of these medications during pregnancy because these medications would suppress the thyroid from excreting hormones, and this could suppress the hormonal growth that would create creatinism, which would result in developmental delay in a child who may be in utero. Some typical signs of hypothyroidism is tired or no energy, increased sleeping, gains weight while eating minimal amounts of food, heart rate, blood pressure, and respiratory rate for the age and size are slowed, always feels cold when others are comfortable, body temperature below normal, a patient may be constipated, increased facial and body hair, decreased scalp hair, is less interested in surroundings and appears to think more slowly. Tongue seems thicker making speech more difficult. Skin is dry and flaky, decreased sex drive, decreased or absent menstruation, and there is usually a erectile dysfunction. In the diagnosis of hypothyroidism, myxedema, skin and tissue disorder caused by the prolonged hypothyroidism. It is difficult to treat. It is an abundance more facial hair, a round moon face appearance, hooded eyes, and a thicker, pronounced facial appearance. Creatinism is slowed brain growth in children. It's caused by a slow hormonal release from the thyroid, and it occurs in utero and in early infancy. Without rapid treatment, mental and growth delayment begins to occur. So thyroid hormone agonist is levothyroxine, also known as Synthroid or Levoxyl, or lithronine, known as Cytomel. This helps to activate the genes for metabolism, speeding up the energy use and work output of each cell. It is a thyroid hormone replacement. The agonist is a drug that mimics the effect of the thyroid hormone of T3 and T4, and it helps to regulate the metabolism. The drugs work like natural thyroid hormones by moving through the blood and entering all cells. The drugs then enter the nucleus and bind to receptors on the DNA, which activates genes for metabolism. And as a result of turning on these genes, the thyroid hormone agonists increase the cell's rate of metabolism, which speeds up the energy and the use of each cell. It is extremely important that a woman who is pregnant continue to take a thyroid hormone agonist medication so that the hormone continues to be excreted for the unborn child, so that creatinism does not develop or participate in developing the developmental delay a child may have. Women who need to take a thyroid agonist are not recommended to take these drugs if they are breastfeeding. And anyone who takes a thyroid hormone agonist drug will need to take this drug potentially for life. Adrenal gland hyperfunction is also referred to as Cushing's disease. This is when there is a hyperfunction or an oversecretion of the cortisol, again known as hypercortisolism or Cushing's disease or Cushing's syndrome. With the Cushing syndrome, the excess cortisol can become issues inside of the body from external sources, such as certain drugs. Prednisone is one of these drugs that can create this problem. Excessive secretion of aldosterone, also called hyperaldosteronism. The most common cause of adrenal gland hyperfunction is an adrenal gland tumor. Sometimes problems in the pituitary gland produces excessive amounts of hormones that stimulate the adrenal gland to produce adrenal hormones. The symptoms that Cushing's disease may display is hypertension, hyperglycemia. The characteristics on a person's body would be a fatty hump on the back between the shoulders, upper body obesity, the rounded moon face appearance, and women may have excessive hair growth on their face, the chest, the abdomen, or the thighs. And the treatment is based on the cause of the excess production and may include surgery or radiation, even chemotherapy, if the pituitary gland is the cause. But finding the root of the problem is the priority here, to suppress what is causing the excessive excretion of the cortisol. Cortisol receptor blockers reduce the cortisol production. Mifepristone, known as cromolyn, is the treatment for patients that have Cushing's disease. This helps to suppress the cortisol and the aldosterone. It is the treatment for the adrenal gland hyperfunction that is caused by a problem in the adrenal glands. The drug therapy can help manage the problems caused by adrenal gland hyperfunction before surgery and in patients who are unable to have surgery. Patients who are planning to become pregnant or who are pregnant need to be aware that this drug causes miscarriages. The adrenal gland hypofunction is a disorder in which the adrenal gland produces little or no cortisol and aldosterone. Conditions that cause or reduce the adrenal gland function include an autoimmune disease that attacks and destroys the adrenal glands, adrenal ectomy, abdominal radiation therapy, and reduced function of the anterior pituitary gland. Major problems resulting from adrenal gland hypofunction are hypoglycemia, salt wasting, hypotension, physical weakness, and high blood potassium levels. Without replacement of the cortisol and aldosterone, adrenal gland hypofunction eventually leads to death. Corticosteroid replacement therapy involves the glucocorticoids, especially prednisone. If further help is needed to replace aldosterone action, the fludrocortisone, also known as Florinaf, is usually used. Glucocorticoids, also known as glucocorticoid hormones. These are identical to natural aldosterone. Glucocortisone acetate, also known as Florinaf, is used in the treatment of Addison's disease. When using this medication, it is extremely important that the patient's vital signs every 4 to 8 hours is assessed during the administration of these medications. The patient's vital signs are going or changing or shifting from hypotension to normal or hypertension. So if the patient gets too much of this medication, they could potentially be hypertensive. If they get too much of this medication, other things can also change, but the vital signs are the most important to monitor. Here's a drug dosage calculation problem. 10 mics per kilogram when the child may weigh 70 pounds. 70 pounds divided by 2.2 equals 31.8181818. You're taking that number, 31.8181818, multiplying it by 10, because that's 10 mics, and you're coming up with an answer of 318.181818. That would really be milligrams. You're looking to see what the answer is looking for. At that point, you're looking to see if it's telling you round to the nearest whole number, round to the nearest tenth, round to the nearest 100th, and it's likely going to ask you to round to the nearest tenth or the nearest whole number. In this scenario, it's asking you to round to the nearest whole number. So here, your answer is 318.181818. If you round to the nearest whole number, your answer is 318 milligrams. How many milliliters to ounces? Milliliters to ounces. 30 milliliters is equal to 1 ounce. 60 milliliters is equal to 2 ounces. 90 milliliters is equal to 3 ounces. 120 milliliters is equal to 4 ounces. 150 milliliters is equal to 5 ounces. 180 milliliters is equal to 6 ounces. How many milliliters is given in an intramuscular injection as a maximum dose if given in the vastus lateralis? It's more ideal to give 1.5 in a vastus lateralis and 0.5 in the other. If you needed to give 3 milliliters, I would divide it up and give 1.5 in each vastus lateralis.